and welcome back everybody to our afternoon session for our spring conference, all around building a legacy for inclusion and diversity. I hope you had a wonderful lunchtime out in the sunshine, and thank you so much for the 20 people that joined in our networking lunch. I believe, couldn't join myself in the end, but I do believe that the conversation was flowing and there were members and new friends alike. So thank you so much for that. I'm so excited about this afternoon, which I will go into in a moment. But I just wanted to remind you how to engage, especially if you weren't able to join us for this morning's session. So all the links that you're going to need for this afternoon are in your delegate pack. The aim really is to get as much discussion, particularly out of Pammy's session, which is following me any moment, as we can. And please use the chat panel to put your questions in there, because they will be sort of picked out and filtered through to Pammy live as we go. So so that's you know, it's going to get most out of it if we interact in a really positive way. The running order, as you know, this morning we concentrated on wellness and the outdoors, and this afternoon we're going to think about who is missing from the outdoors. I think the trends and insight that we shared this morning from a whole host of people from across the nations was so insightful. Now is really a chance through the sessions this afternoon to put that into context and think really about the groups that we are less likely to see and engage with currently. Okay, so Pammy will go first and I'll introduce her in a moment. Then we're going to have another 4 short presentations from people talking about groups underrepresented in the outdoors, another chance to stretch your legs, and then some really practical things about improving green provision and infrastructure to meet the needs of underrepresented groups, followed again by a Q&A at the end. So that's how we're going to go this afternoon. Next session, which continues to look at groups underrepresented in the outdoors and people on low incomes, people with disability or low mobility, the male-female divide, the rural-urban split, and children and younger people. So I'm going to hand back to Dr. Beth Brockett from Natural England. And as you know, there were 1 or 2 quite quiet videos this morning. We've done our best to try and up the volume of those. So hopefully, as they run through to Duncan Stewart next, after Beth, and then Aileen Armstrong again, some of the sound quality should be a little bit better. But thank you very much, and I'll come back to you when they run.
Hello, thanks for inviting me to present. I'm sorry I can't be with you in person today. So many of you will have heard my first presentation, so I'll very briefly just say that the data I'm presenting here is from the Natural England's People and Nature Survey, which is a representative online survey of 25,000 adults living in England per year. You can see an overview of the methodology here, and I'll be reporting on our Q1 data, so that collected between April and June last year, 2020, and we'll be revisiting these findings for our Year 1 report this autumn. I'll also report on some headline findings from our August survey of 1,500 children aged between 8 to 15, and a reminder that the People and Nature Survey builds on 10 years of data collected by the Monitoring of Engagement with the Natural Environment, or MENE survey, which I'll be referring to at points in this presentation. So who's not getting out? Are any particular communities getting out less than others since April? So don't look at the tiny text on these graphs, just you need to know that the vertical axis is showing proportion of adults in England, 0 to 80%. And we can see here that people in poorer, more deprived communities are getting out less. The same patterns are seen for less educated and for unemployed people, and similar patterns are seen in MENE. So socioeconomic factors clearly play a role, and there's evidence that these inequalities have been exacerbated by COVID. And the same patterns we've seen in our children's survey in August, with 73% of children from lower income households spending less time outside since the pandemic started, compared with 57% from higher income households. And we also found that adults from ethnic minority groups were less likely to visit a natural space. This spring, 51% of adults from ethnic minority groups took a visit in the last 14 days, compared to 60% of white British adults. And children from from ethnic minority backgrounds were spending less time outside since coronavirus than white children. And they also reported higher levels of worry. And this finding is consistent with that of the Meany survey, which showed adults and children from Black, Asian and minority ethnic backgrounds were less likely to spend time in the natural environment than those from white backgrounds. And there may be differences in visit rates in the People in Nature survey data between individual ethnic minority groups, but the sample size at that stage, at the Q1 stage, were too small to robustly interpret any variation between those groups, and we plan to look in more detail in future releases when we've got larger sample sizes. So we've also found that having a long-term illness or condition makes it less likely people will visit natural spaces. So 47% of adults with long-term illness or condition have taken a visit in the last 14 days, compared to 62% of people who didn't have a long-term illness or condition. And older adults are less likely to visit natural spaces. And we'll be analysing the Year 1 data further and looking at data from people with disabilities in this summer. So it's clearly important to understand the barriers to accessing nature and natural spaces, including new barriers and those which have become more problematic or prominent due to COVID. And we hope to do more in-depth analysis on this for different population groups in the Year 1 report. And we're also learning from our research partnerships. But last spring, as you can probably guess, the main reason people gave for not visiting green and natural spaces was to stop coronavirus spreading and adhere to government restrictions. And this accounted for 67% of responses on average this spring to the question, why have you not visited a natural space? So this has changed since April, and the graph you can see here is derived from the People in Nature survey too, but it's from our monthly reports where we release a subset of indicators so we can track changes over time. And you can see the relative importance of COVID and the weather, the two top reasons given, since April. And it's worth noting that while there have been variable COVID-related restrictions since April, people have been advised to get out once a day for health and well-being reasons. Another key barriers identified were being too busy, and that's at work, home, with family commitments, and that accounted for 15% of responses to why people hadn't visited nature in the last 14 days. And poor health and or well-being was also a key barrier, physical and or mental, which accounted for 15% of responses. Antisocial behaviour and lack of facilities were flagged as key concerns by people who aren't getting out into nature as well. And we found some indication that COVID restrictions were exacerbating some barriers, and we'll be exploring this in future reports. So thank you for listening. It's a bit of a whistle-stop tour. There's a lot more to discover on the Hub, user hub, with the link here, and including the Q1 report in full and some contact details for the team. Thank you very much for listening.
Over the next few minutes, I'm going to provide a very quick summary of a recent new analysis we've undertaken for Natural England using data from their two major population surveys. The Monitor of Engagement with the Natural Environment, or MINI, which ran from 2009 to 2019, and some initial findings from their new People in Nature survey, or PANS, using data for the period from April to September 2020. The new analysis have looked at the results from both of these surveys in a way that hasn't been done a great deal before, comparing the responses provided by men with those provided by women. We're going to whiz through the following 6 topics. Let's start by looking at levels of engagement with nature. On average, nature is more important to women than men. Meany found that women were more likely to agree strongly that spending time out of doors is an important part of their life, or that having open green spaces close to where they live is important. The new PANS survey also found that in 2020 women were more likely to agree that they always found beauty in nature, that being in nature makes them very happy, and that they were taking more time to notice everyday nature. Women are also more likely than men to engage with nature at home and in the garden. Many recorded higher levels of participation in a wide range of activities, such as spending time in the garden or watching nature programs on TV, Also, during 2020, PANS found that a higher percentage of women than men had increased the time they spent outdoors, the amount of time they were spending noticing wildlife or connecting with other people outdoors during the coronavirus pandemic. However, in contrast, a higher percentage of men than women had increased the amount of time they were spending exercising outdoors during 2020. In terms of levels of concern for the natural environment, women also tend to have higher levels of concern than men. The chart shows results from PANS during 2020 illustrating the range of issues concerning the population. More women than men were concerned about the environment, and also issues relating to health and education in schools. Issues that attracted more concern from men were the economy and matters relating to Europe. And when it comes to pro-environmental behaviours, women are also more likely than men to report taking action. In particular, higher percentages regularly recycle items, take their own bags shopping, or turn off lights or appliances to save energy. Now, moving on to recreational time spent outdoors. While in general men and women spend similar amounts of time outdoors on average, the reasons for doing so are often very different. In general, women are more likely than men to visit the outdoors because they need to exercise a dog, because they want to spend time with family, or because they need to entertain children. However, men are more likely than women to spend time outdoors for their own health and exercise. Analysis of data from the Mini Children's Survey found that this pattern started from an early age, with 10 to 15-year-old boys more likely than girls in the same age band to be motivated to spend time outdoors to do something physically active. And reflecting the different motives for taking visits, on average the places visited and the activities undertaken by women and men varied. Mini recorded that a higher percentage of women than men relaxed in their garden, took part in walking or socialising outdoors, and the places they visited were more likely to be within a mile of home and travelled to on foot. In contrast, men were more likely than women to take part in more active pursuits like running, cycling and water sports, and to go to places further from home to take part in these activities. The benefits that are obtained from time spent outdoors also varies between men and women. Overall, women appear to obtain stronger benefits. Mini recorded that when women thought about their last visit to the outdoors, they were more likely than men to strongly agree with all of the statements shown in the chart, ranging from higher levels of enjoyment to feeling more relaxed and closer to nature. Also, during 2020, PANS found that women were more likely than men to indicate that nature and wildlife had become more important than ever to their well-being. However, women and men also face different barriers when it comes to the issues which prevent them from spending more time outdoors. Many found that in general, men were more likely to state that being too busy at work or just not being interested stopped them from spending time outdoors more often than they currently do. However, women were more likely than men to restrict their time enjoying the outdoors due to being too busy at home or because of caring responsibilities. Also, PANS found that during 2020, women were somewhat more likely than men to feel concerned about a range of factors when they were visiting green spaces. These included risks relating to coronavirus, a lack of facilities in green spaces, and a range of safety concerns, including worries about people being there and being alone. And finally, our analysis included some results relating to children aged under 16. We found that while the majority of both boys and girls spent time outdoors most weeks, time spent outdoors without adults was much lower, and as children got older, participation by girls reduced to levels lower than amongst boys. Specifically, in the 10 to 15-year-old age band, boys were more likely to spend time outdoors independently, without adults but with friends or on their own. The PANS survey has also shown that during 2020, one of the impacts of coronavirus was a decrease in the time spent outdoors by children, especially time without adults present, for example with friends. So thank you very much for your time. That's been a very brief summary of the headline results, but if you'd like to find out more, look out for the full result of this analysis, which will be available sometime soon on the Natural England website. Thank you very much.
Hello, I'm Aileen Armstrong from Nature Scot, and I'm going to spend a few minutes talking about the impact of the coronavirus pandemic on some of the population groups traditionally underrepresented in outdoor recreation. And in particular, I'm going to focus on 4 key measures: access to private gardens and local green space, frequency of visiting the outdoors, the amount of time spent outdoors, and people's future intentions regarding outdoor visits. And just a little background for anyone who didn't see my earlier presentation. In 2020, NatureScot commissioned 2 separate waves of online research to help us understand people's outdoor visit behaviour and engagement with nature during the coronavirus crisis. Wave 1 was undertaken in June 2020, when we asked respondents to tell us about the period between late March and late May, when the country was in lockdown, and Wave 2 was undertaken in September 2020, when we asked respondents to tell us about the previous 4 weeks, so mid-August to early September, by which time lockdown restrictions had been significantly eased. So, what did we find out? We know that many people have been making good use of their gardens and more use of local green space during the pandemic, and so to put our other research findings in context, I'm going to start by looking at access to private garden space and local green space. Most people in Scotland have access to some sort of private garden space, but access is significantly lower than average among some population groups. In particular, only 49% of people living in Scotland's most deprived areas and 58% of those living in large urban areas have access to a private garden. In addition, members of the BAME community, younger adults aged under 35 and those with a long-term limiting condition also have lower than average levels of access. Looking at access to good quality local green space, we found that while most people in Scotland report that they can access usable green space from their homes, some population groups are less likely to be able to do so than others. For instance, only 56% of those in poor health have access to good quality local green space. Those with a long-term limiting condition also have lower than average access, while people living in Scotland's most deprived areas are less likely than those living outside of these areas to be able to access usable green space from home. As well as highlighting inequalities in access to private garden space and local green space, the research also highlighted persistent inequalities in regular participation in outdoor recreation. In this chart, the green blocks in each bar show the proportion of each population group visiting the outdoors on a regular weekly basis during Wave 2 of the research, so the mid-August to early September 2020 period. As I mentioned in my previous presentation, at a population level, weekly participation in outdoor recreation was higher than we'd normally expect to see at the time of year in both waves of the research, and we also saw an increase in weekly participation across all population groups between Wave 1 of the research, covering the March to May period, and Wave 2, covering the August to September period. However, as you can see, weekly participation in the August to September period remained lower among some population groups, and these included people living in the most deprived areas, people in poorer health, those with a long-term limiting condition, and older people. Weekly participation among BAME respondents was also slightly lower than among those of white ethnicity. As well as asking people about frequency of participation in outdoor recreation, we also asked respondents in each survey wave to tell us about the amount of time they'd spent outdoors for leisure, recreation or exercise, and how that compared with the same period in 2019. In Wave 1 of the research, March to May 2020, we saw an increase in frequency of weekly visits to the outdoors across the population as a whole compared to the same period in 2019. But as you can see in the second column of this table, we also saw an overall reduction in the amount of time people were spending outdoors compared to the previous year, a net decrease of -6%. And that decrease was more pronounced among those not in good health, those aged over 70, and those with a limiting long-term condition. In Wave 2 of the research, August to September 2020, we saw again an increase in frequency of weekly visits across the population as a whole compared to the same period in 2019. And this time we also saw, with the easing of lockdown restrictions, an overall increase in the amount of time people were spending outdoors compared to 2019, a net increase of +16%. But that level of increase was significantly smaller among older people and among those not in good health. And finally, we asked people to tell us about their future intentions with regards to visiting the outdoors. As I mentioned in my previous presentation, At a population level, we found that around half of respondents in both waves of research expected to visit the outdoors for leisure, recreation or exercise more frequently once the crisis was over. This proportion was higher among younger people, people with children at home, with dogs in their household, among women and among those with access to a car. Although only 10% of the population expected to visit less in future, this proportion was higher among members of the BAME community, people living in Scotland's most deprived areas, and those without car access. So these are some of the main findings from our research with regards to underrepresented groups, and for more information, check out the Measuring Participation page of the Nature Scot website. Thank you.
I'm now going to briefly share a few of the key results from the Outdoor Recreation Northern Ireland survey, which was undertaken in November and December 2020. Firstly, we'll focus on the findings for people who reported that they had a disability or long-term illness. During this period, people with a disability were less likely to visit the outdoors as frequently as the population average. 30% generally took visits less than once a month. That compares to 19% in the population as a whole. However, as shown in blue, when visits taken by this population group were taken, they were for a wider range of motivations, in particular exercise, to exercise a dog and to enjoy scenery and wildlife. And when visits were taken, most participants obtained benefits. In particular, the largest percentages felt calm and relaxed. But during 2020, coronavirus has impacted this group more significantly than others. 51% of people with disabilities who we surveyed had decreased their time spent outdoors compared to a year before. COVID-19 restrictions and concerns were the main barriers which impacted on their time spent outdoors, but health issues, worries about safety and a lack of suitable places to go to were also issues, more so amongst this group than the general population. Related, we also found that people with disabilities were less positive than the population average when it came to rating the quality of their local green spaces and paths and trails. As this chart shows, fewer agreed that these places were accessible to them or had the facilities that they needed. Next, let's stick with the same survey for ORN but look at a different comparison. This time we're comparing the responses from people living in urban and rural areas as defined using the standard NISRA classifications. Firstly, in terms of the general frequency of visit taking, there isn't a significant difference between people living in urban and rural areas. However, when we look at the reasons for taking visits, it's notable that certain reasons come through as more likely to motivate urban residents, shown by the grey bars, in particular health, fitness and exercise. In terms of benefits obtained from time spent outdoors, these are largely similar for urban and rural residents, but the main exception is a higher percentage of urban residents who agree that the experience made them feel refreshed and revitalised. When we look at the barriers which impact on the ability to spend time outdoors, we see greater differences between the urban and rural Northern Ireland population. In 2020, while people who lived in urban areas were more likely to mention restrictions and concerns linked to coronavirus, rural residents, shown by the green bar, were more likely to mention issues related to their health, a lack of suitable places to go. Also related to the places that people can go to, when we asked respondents to rate their local green spaces, paths and trails, in general lower ratings were given by rural residents, especially in terms of places to go which were close to home.
Our next speaker, Dr. Caroline Ward, who's a postdoctoral researcher from the University of York, is our next speaker. She's doing a much more in-depth session for the next 15 minutes now on some of the qualitative work that she's been doing around a study in Leeds. So, and I will say that some of these speakers now will be joining us for our Q&A session later. And that, you know, to keep those questions coming in. So I'm now going to hand over to Caroline, and we can learn about her qualitative stuff that she's found and researched through her study in Leeds.
Great. Firstly, I'd just like to start off by saying thank you so much for the invitation to speak at the conference. I'm really pleased to be able to share some of my research findings with you. So to introduce myself, my name is Caroline Ward. I'm a postdoctoral researcher based at the Leverhulme Centre for Anthropocene Biodiversity which is at the University of York. And today I'm going to speak a bit about some of the work that I've been doing over the last year, looking at inequalities in accessing green spaces and the impacts of COVID-19 lockdowns. And this project was jointly established with the social science team at Natural England. So I'll dive straight into some background. As this is pre-recorded and I'm the final speaker in this session, I do apologise. I think there's probably going to be a bit of overlap with previous speakers. So first of all, there is a growing body of research that shows that spending time in green spaces or natural environments has benefits for our physical and mental well-being. Some of those documented benefits include higher self-reported health and well-being, lower levels of cardiovascular mortality, lower incidences of type 2 diabetes, healthier infant birth weights, higher mental well-being and reduced levels of depression. So that's quite a lot of benefits there. And the mechanisms driving these outcomes might include increases in physical activity, social interaction, development of skills and capabilities, and reduce any impacts of pollution. But at the same time, as we can see on the right-hand side of the screen, there is evidence that not everyone in England is able to access those benefits equally, with older people, ethnic minorities, and people with ill health less likely to visit or spend time in natural or green spaces. And then, of course, we had COVID, which meant that during lockdown and these restrictions on our movement, access to green spaces or the outdoors became even more vital. And there was a lot of narratives portrayed about people being able to spend more time in green spaces. But at the same time, we weren't really sure how that was going to impact the existing inequalities that we knew about. So together with Natural England, social science experts and my colleagues at the University of York, we came up with these 4 research questions. The overall aim was being to gather some more qualitative evidence, so understanding some really in-depth information on the drivers behind those inequalities. Given that this is a relatively short presentation, I'm just going to focus on the 2 questions in bold, so perceived barriers to accessing green spaces and what impact COVID-19 lockdown and associated restrictions had on access to green spaces, again, perceived impacts, because I think those are the most interesting to share. But if you are interested in the rest, then please feel free to get in touch with me and I'm happy to chat more about that. So recruiting participants in a pandemic doesn't sound that easy, but I managed to recruit 40 participants from Leeds. I chose to focus on Leeds as it's got a relatively diverse population and also a fairly average spread of green spaces for a UK city. So I contacted these people through the Resident and Housing Association email lists, and I really emphasised that I wanted to speak to sort of minority groups, so maybe people part of ethnic minority groups, people with disabilities, people who are on low incomes. So just trying to really recruit those people who the evidence had already suggested were suffering from inequalities. I wasn't aiming for a representative sample, it's a qualitative study, but I just really wanted to get a wide range of views and opinions to give a little more in-depth information to this inequality data that we have. So each of the participants took part in a semi-structured interview via Zoom or telephone, depending on their preference. And also before the interview took place, I asked them to take photos of a positive or negative aspect of visits to green spaces. So the photos that you'll see scattered throughout this presentation, they all come from my participants. I do, of course, have permission to share the photos as well. So the interviews were really informal, and it was more about having a conversation about how they felt about green spaces locally and also further afield. And we discussed thinking before COVID lockdowns, what their experiences and frequencies of visits had been during the lockdown, and then also asked them to think about into the future whether anything they'd experienced during COVID might change their behaviour in the future. So I'm going to skip straight on to the findings because I think this is the bit that people will be most interested in. So first of all, thinking about barriers to accessing green spaces, and this is thinking before COVID-19 in general day-to-day life. So overall, through my participants, the most frequently identified barriers that people mentioned were accessibility and safety. So when I say accessibility, I'm talking about affordability and the availability of public transport most frequently. So basically anything to do with being able to physically get to these places. So for example, one participant said, accessing green space is basically all about public transport, and that's why I find that I'm usually in my local park, because it is usually 2 buses to anywhere else and 2 buses back home. So that really summarises what people were discussing for that barrier. And then safety, mainly concerns about being maybe slightly isolated in green spaces, maybe any sort of reports of antisocial behaviour that people had heard of that made them just not feel very safe about spending time in these areas. And that was particularly a concern relating to Woodlands. So again, I'll read the quote. It's kind of a wooded area, but I think it's quite dense, so I wouldn't feel safe there. And then there's another set of woods sort of further afield, which again, I'd love to go in, but I don't go in there. And I think the reason for that is because there have been reports in the past of people being attacked and flashes there and stuff like that, really. So it's just really this idea of that green spaces were sometimes not very safe spaces to be in. And that meant people wouldn't want to spend time there. But, and this is the key point, the barriers that people identify to visiting green spaces really massively varied between demographic groups. So for example, gender, ethnicity, whether people had disabilities, whether they were benefits recipients, and I'll give a few examples of those next. So for example, the participants I spoke to who were Black, Asian or a minority ethnic group, the most frequently mentioned barrier that they would discuss would be this idea of feeling unwelcome or uncomfortable being a minority in a green space. And this also included experience of harassment or racism that they'd either experienced themselves or that they'd heard of other people finding in green spaces. So I think these 2 quotes kind of summarise the sorts of things that people were telling me. So sometimes you're picking and choosing where you might go, where you feel most comfortable or where you feel like there might be more representation. It was like when I went to the sculpture park, you're kind of looking for where's the other person of colour. And this other participant. With me, I'd think about going to parks in certain areas because I'm Asian, I wear a headscarf, I'm Muslim. So, you know, I'd be a bit wary about going to certain areas of the city, certain parks. And then moving on to people with disabilities or long-term health conditions, for them, the main barrier that they would raise would be an issue of physical accessibility, I've called it, an idea that maybe you know, the entrances, like in this photo, weren't accessible for them to get through in a wheelchair or in a power chair, or the paths were very difficult to navigate, those sorts of things. So for example, getting somewhere that you can get a power chair through or a wheelchair, they're trying to encourage people to go out and get fresh air and that sort of thing. And yes, I'm on my own, but I know families where one person's in a wheelchair, and if they want to go for a family walk, it's got to be accessible. And it's so just appalling that so little is in an area that is being designated as a pathway and a walk that should be accessible. And often the only thing that's stopping it being accessible is the entry point. And then looking at gender for women, the most important barrier for them was this idea of safety, which I already mentioned was quite high up for people overall, but specifically this was raised by women who participated in the interviews. So for example, in the parks that are near here, you get groups of people kind of just, I want to say loitering, but it doesn't make me feel safe as a woman by myself. On an evening, if you go to those places where there's things like drinking, teenagers hanging around, there's antisocial behaviour on the streets and stuff. So it's not somewhere where I would want to spend my time. And then moving on to how COVID impacted people's visiting green spaces. So as was kind of reflected in the media, the majority of people that we spoke to had increased their visits to green spaces during lockdown. And this was generally to do with people saying they had more time to go and visit these spaces, maybe because they were spending less time commuting, or some people were on furlough. And also this idea of being stuck inside meant that people really wanted to make sure that they got outside when they got the chance. So as this participant said, I think with lockdown, it kind of brought us back into those green spaces. I think we probably forget that we went in the car and went to Roundhay Park for a walk around the lake. So yes, I think it certainly reconnected us a bit more back with going to green spaces on a more frequent basis. But again, this wasn't uniform across all of the participants, and we found that people who had disabilities or long-term health conditions and who were from more deprived areas tended to say that actually they decreased their frequency of visits to green spaces during COVID compared to beforehand. And so for participants with disabilities or long-term health conditions, many of them were shielding, so that would make sense. But there was also an issue that a lot of them had relied on public transport or friends or family in order to get to these places, and this wasn't possible during lockdowns or some of the other restrictions. Or people felt that they shouldn't be taking public transport because it wasn't maybe a necessary or important journey. So for example, this participant said, there's places that I've previously gone with friends and got public transport with buses, but I kind of feel at the minute that unless you have to get on a bus, you probably shouldn't, because there are some people who need to. So I haven't for that reason, and some of the places are just really difficult to get to by public transport, unfortunately, with the nature of what they are. They're kind of in the middle of nowhere. I think there's lots of green spaces that are just not accessible unless you've got a car, which is really unfortunate. And the participants who are from more deprived areas raised similar issues of the fact that, again, they'd relied on public transport, friends and family, to get to green spaces because they didn't have access to a car. But they phrased it more because their local green spaces were places that they didn't feel safe in or they didn't want to spend time in. So for example, my nearest space is called a park, but it's not really a green space. You know, it's called a park, but it's literally a concrete area with some play equipment in. So that's not a place that I would visit. It's quite depressing. I wouldn't even want to sit in there. I don't have kids, but if I did, I wouldn't want to take my kids in there. And then there's another local park, but again, I wouldn't feel safe. I don't feel safe in there. So what are the main conclusions from this research? So first of all, I think it's really important that we recognise in our efforts to increase people's use of green spaces that there isn't going to be a one-size-fits-all solution. There are clearly different barriers for different demographic groups, and even when they identify the same barriers, they have differing levels of importance. Having said that, improving public transport links and affordability of those public transport options to green spaces was clearly important for all demographic groups that we spoke to. But at the same time, that's not going to solve the wider societal issues, such as those raised by BAME respondents of issues of racism or feeling isolated as a minority in these spaces, or the issues of physical access for people with disabilities. So although it is a barrier that's raised by all these groups, it's not necessarily the main barrier for all of them. Secondly, the local context of green spaces and the quality of green spaces clearly matter. People didn't really discuss distances of green spaces, but it was sort of implicitly mentioned in all of these responses. I mean, people wouldn't feel that they had to travel further if they had local green spaces that they enjoyed spending time in and felt safe in. Of course, there will always be people who want to get out to sort of wider rural landscape sorts of places, and those won't be in urban areas. But people were often talking about taking buses or travelling to get to a park somewhere else, which suggests that their local parks either weren't there or they weren't spaces that they wanted to spend time in. And I did also look at the amount of green space within a 1 kilometre radius of all of my participants, but that didn't relate to any of the barriers raised. So it's not that these people are living in areas that supposedly have a lower quantity of green space. It's just that it's not green spaces that they value or want to spend time in. It's also clear that lockdown has exacerbated some of these existing inequalities, and you might think as we're moving away from lockdown, maybe we don't need to worry about that anymore, but I think we've all learned that the unpredictable is always possible, and we may well end up having more restrictions in the future. So it's really important that we do think more about this, and also it does maybe show those inequalities in a brighter light. So I think it is still something that we need to consider. And finally, I'd really like to reflect on directions for future research. So this was a relatively small sample size. It was a qualitative study, so that was kind of the aim. But my next focus would be to dive even deeper. I think there's been a lot of discussion about using the BAME terminology, that it risks homogenizing very distinct cultures and groups within that term. So it's really important that we do more research diving deeper and looking at each of those groups individually to understand differences between them. Also, having a small sample size meant I wasn't able to draw out issues of intersectionality. Again, it wasn't the purpose of the study, but I think that's going to be really important when we're talking about certain barriers for certain groups. If you think if people fit into multiples of those groups, then that's going to be even more barriers for them to access green spaces. So I will stop there. I'd just like to say, firstly, thank you for listening. I hope it's been interesting, but I'd also like to acknowledge all of my study participants who are fantastic, my postdoc supervisors, and also the Natural England social science team who really helped with shaping this study. So I look forward to some discussion and some questions. Thank you.
Hello and welcome back. So, short but sweet. Now we're going to move on to, and I must say that Duncan will be with us very shortly to answer questions, so you will get to see the real Duncan by the end. I'm now going to move on to Sophie Gordon, who, as I said, is campaigns officer for Cycling UK, and Sophie's going to kindly share with us research on the demographic groups that Cycling UK have been working on. So I'm going to hand over to you now, Sophie.
Thanks, Bridget. There we go. Hopefully you can hear me now. I've done it right. Thanks, Bridget, and thanks very much to everybody who's been speaking already. It's been really interesting. So yeah, I suppose I'll touch very briefly on some research, but as we've had a lot of that already, I'm then going to move on to a sort of practical application of how we can start tackling those barriers and including more people in getting outdoors and enjoying the benefits of nature. So if you can do the next slide, please, Elizabeth. So yeah, it won't surprise you to hear that focusing specifically on cycling, a lot of the barriers are much the same in terms of the groups that are underrepresented in getting outdoors. So, for example, men cycle 3 times as frequently as women and do nearly 4 times as much distance. And Black and South Asian ethnic groups are less likely to cycle. Although, of course, we have a lot of variation within and around that. Unfortunately, the surveys don't always take that into account. So I think it was kind of, you had Chinese, Black, South Asian, and then mixed and other, which are a bit vague and not necessarily very helpful to pull out the variation. And then, of course, people with living with a limiting disability, or people who are long-term employed or in the low-income groups. Although the interesting thing about specifically cycling is that, as well as being recreation, it's also a mode of transport. So you do find that if you're looking specifically at cycling to work or cycling for travel, then there's a bit more variation with income because cycling is a cheap mode of transport. So whilst you don't get as many people cycling for leisure, you do get that variation in the travel. Next slide, please. So if we look at the standard enthusiast model, Cycling UK carried out an off-road survey a few years ago, just to find out sort of about the current UK scene and what that looks like. And you do tend to find that people who identify as mountain bikers or off-road cyclists tend to look a bit like these guys. 92% of the respondents were classed as white British, and 87% were male, and they tended to be sort of fairly well off. I think most of the incomes were sort of in the 30 to 50k bracket or the 50 to 100k bracket. Next slide, please. So in terms of the specific barriers and how we start overcoming those, one of the biggest barriers for a lot of people for cycling is the perception of safety, which is different to actual safety, because cycling is safe if you look at the statistics, but it doesn't always feel safe. So often people might have, one kind of close passing incident that shakes them up a little bit, and then they think, oh no, I don't want to cycle on the roads. So we need safe, traffic-free places to ride. but then knowing where to go and how to find those can be difficult, because in that off-road survey, again, 85% of the respondents said that they find it difficult to put together a route because of the rights of way system in England, and the fact that the routes you can ride on don't always connect. And these are people who are enthusiasts, they're experienced, they're used to putting together routes. So if you then take into account someone who doesn't really know how to read a map, isn't sure where to go in their local area, then it can be quite difficult to link up those places. And then, of course, with cycling, access to a bike is another big barrier. If you haven't got one, then you're not really going to consider going out for a ride. And another final one is people that look like you and thinking, yes, cycling is something for me and it's something that I can do. So creating groups where people can support each other and go out for a ride together and see those role models within their community is really important. Next slide, please. So how does this relate to green infrastructure and creating trails? I think the next two speakers are probably going to talk a bit more about what you think of as building and creating trails. But I'm going to talk about something that's more about connecting and promoting the assets that we already have. Because I'm sure a lot of us on this call have kind of found little paths or things in our local area that we didn't know existed before, just because you never spotted them. And this is true for a lot of other people, that they might think, oh yeah, there's a nice place I like to go over there, but I don't know how to get to it, or there's a busy road, or I wouldn't know how to cycle there. So a lot of it is just signposting and promoting the quiet traffic-free routes that already exist, whether that's canal towpaths or cycle paths or woodland trails that they weren't sure whether they could ride on before, and how we link those together. Next slide, please. So this is a project that we came up with last year and made a funding application for. Unfortunately, we weren't successful with the funding application, but I thought it was still a good example of something that's in the pipeline that Cycling UK is hoping to do in the future. And it just kind of shows how a practical example of how you can promote these things. So the idea with this, it was in the Liverpool City region, hence the name of the Liver Loops and the Liver Trails. And it was about short recreational loops. We know from previous research that's been done that people value circular trails more than linear ones, just because it's a bit easier in practical terms. So they'd be a kind of 9 to nature theme, 9 miles or less, going out from deprived urban areas within the city, out to green space, to nature, to woodlands. And as I said, it's a way of linking existing trails in a way that people might find it difficult to figure out themselves, and signposting that and promoting it. Next slide, please. So this would be based in 6 boroughs, and it would have these 6 shorter loops, and then 1 longer Liver trail that would connect them all up, so people can build on that experience and then go to the longer routes. So how do we decide where to do this and who's going to benefit it? And the process would very much start with kind of community engagement and mapping the existing data that we have and the resources that are available. So this is one example. It's the index of multiple deprivation. Unfortunately, you can see from the red bits, there are quite a lot of areas that are quite deprived within the city region. So then we'd add to that other areas such as, well, where are the accessible green spaces? Where are the areas where people might not have access to green space? Where do people have the worst health outcomes? Where are the ethnically diverse communities that we might want to work with? And so once we've kind of gone through that process and consulted with our members and groups in the area, then we can choose which areas to focus in on. Next slide, please. And then I just wanted to bring it all together at the end and say the final product that we'd have would be these routes. And we found that it's really important. It's not just about the routes, it's about the full experience of riding them. So quite often you might find a promoted route that's a map on an obscure page on a website somewhere, but it's about the history and the culture and the wildlife that you find around the route. And the bike or the walking almost becomes incidental. It's more of a journey of going to find out what's in your local area. And you can bring that to life with interactive maps or video or maps with descriptions and pictures, and it becomes sort of a discovery of your local area while getting out, getting active and connecting with nature. And the really important part of this is our existing relationships and activities around Liverpool City region, because we're quite fortunate we've got several members of staff based there, and I believe 16 community clubs. So these are set up in and supported by Cycling UK staff, and they might be kind of specific groups of people to come together. So we have a couple of groups that are kind of Muslim women only because they feel more comfortable like that, or we have adapted bikes available so that people with physical disabilities can come and try them and have a go at cycling when they didn't realise that it's something they could do before. Next slide, please. So I think the trails is just the final part of it, that you have to start with kind of giving someone access to a bike so they can have a go at it, and then provide that training just either to learn to ride or to then develop into a ride leader so they can connect with the other people in the group and go out and lead rides themselves. And then forming part of this community club so they can see people around them that think, oh yeah, that's somebody like me, someone who I can identify with, and having the social aspect. So you think, oh, I don't want to go out by myself, but well, they're all meeting up tomorrow, so I've got to go, better put the jacket on. And then finally, once people have gained that confidence, that's where the routes come in, because they can start by using them with the group rides, but then they think, oh, actually, I do fancy taking the kids out today, and we're going to go and give that a go. And I know where to go, I know how to find the route, I know that it will be waymarked, I'm not going to get lost. So I can go and have that adventure then by myself and take other people along with me. Next slide, please. So I think that was it. Oh yeah, I just have my email on there if anyone wants to find out more about it. But yeah, in summary, I think it's the whole process that's really important. It's how do you bring people in from the beginning with a group and a community around them, and then once they've gained that confidence, that's where the green infrastructure and the routes come in so that they can then go off and explore on their own.
Thank you, Sophie. Some really, really interesting and very relevant pertinent points there. Thank you so much. We're going to now move to a recorded presentation by one of my colleagues, actually, Julia Matthews, who's a landscape architect with Forestry England. And then after Julia, we'll come to John Duffy for our last live presentation. So I'm going to hand over to Julia now.
Hello everyone, I'm Julia Matthews, Landscape Architect for Forestry England, and I'm just going to talk to you a little bit about our design guide for inclusive woodlands that was produced in collaboration with the Sensory Trust. Now we all know our visitors are all unique, they're different, they're seeking different experiences, but our vision at Forestry England is to connect everyone to the nation's forests. So in order to be able to do this, we need to build an environment that is as inclusive as possible for our visitors. And it recognises and accommodates the differences in the way people use the forest. It will facilitate equal and intuitive use by everyone. So it doesn't physically or socially separate or discriminate or isolate. It accommodates diverse user needs from childhood to adulthood through to old age, across all abilities, disabilities, embracing every background, gender, sexual orientation, ethnicity and culture, all the protected characteristics under the Equality Act. What are the challenges to this inclusive approach to design? Well, working within the natural environment is a challenge in itself. Many of our sites have limiting factors such as the topography, ground conditions, designated landscapes or habitats, and a lack of access to utilities and services on many of our remote locations. There's also disability perception. So we quite often associate disability with a physical, visual impairment, such as somebody in a wheelchair, for example, that long-standing symbol of disability. But thankfully, particularly in recent years, we're becoming much more aware of all those non-visible disabilities, such as mental health problems. So really understanding the diversity of users to help inform us of our decision-making when it comes to accessibility. I've mentioned the Equality Act and covering all the protected characteristics, and also just challenging our own assumptions that we may already have about what is accessible. And this guide was really produced to provide a practical design guide for anyone within Forestry England to use when they're thinking about changes to improvements to accessibility. And what are the benefits to an inclusive approach? Well, there are multiple benefits. We get a better customer experience for all of our visitors. So not just those with disabilities or those with protected characteristics, but everybody should be benefiting from universal or inclusive design. We as an organisation and as individuals can learn from a wider diversity of visitors. It may lead to lower costs, so not having to retrofit infrastructure at a later date because we haven't met the regulations or we're not as accessible as we could be. So if we're thinking about it right from the beginning, we shouldn't run into problems later on. Meeting regulatory requirements and also future-proofing our sites. So the more diverse our visitor base is, the more resilient we are as an organisation. And just to cover quickly some of the barriers to access. So a barrier to access is anything that prevents or dissuades people from visiting. This isn't just physical barriers. So this might be financial, social, political, psychological. There are many things that will maybe stop someone from coming to a rural site, a Forestry England site. This guide is primarily aimed at overcoming physical barriers because it's to do with external recreation infrastructure on our sites and how we can improve that. But we just need to remember that there are other barriers that stop people from visiting the countryside, and those need to be addressed alongside the physical barriers to access as well. And also some psychological barriers can be overcome through physical improvements. So, for example, site legibility. Some people feel uncomfortable in a rural environment or a forest environment because they think they might get lost or they won't be able to find their way. So the easier we can make it for people to read the site, to find their way around the forest, to choose a suitable trail for themselves, the more people we're going to be able to get there in the first place. And while it isn't reasonable to expect all of our forest centres and key recreation sites to provide a fully accessible environment at all times and all locations, it is reasonable to expect each site to have some elements that are fully accessible and to build in this thinking from the beginning when you're upgrading or when you're installing facilities. So we've created a sort of management zone for accessibility where you've got 4 zones. Zone A, which is accessible for all, around the car park, toilets, visitor centre, cafe. It should have at least one fully accessible trail and a feature of interest, maybe a play area. And then you'll have Zone B, which is accessible for most. So you'll have a longer trail, but maybe some alternative routes, some shorter routes, some more features, maybe some play elements. And then you'll have Zone C, which is accessible for some. So that might be all the other waymarked trails within your forest centre. And then there's the wider forest. But then it's really important to note, whilst you're looking at this zoning, and it might help you make decisions along the way and help you make your Zone A fully accessible and think about what you can do to achieve that, it's also important to note that sometimes it's the really small interventions that can have a big impact on accessibility. So these zones are merely a guide. For example, in the wider forest, simply replacing a stile with a gap will improve accessibility for a number of users. Now, simply removing physical barriers to access and making a site physically accessible doesn't automatically mean that all visitors will want to spend time in it. And this is where the quality of the visitor experience is equally important. When you're considering plan improvements for inclusivity on sites and outdoor locations, consider these following things. So look for the least restrictive option. This is something that's echoed that was introduced in the by all reasonable means guidance that some of you may be familiar with. Look for existing sensory qualities and opportunities on your sites and look to enhance them. So you may already have features on your sites, maybe a sculpture or a wonderful viewpoint, or just an area of woodland that's particularly beautiful, or an area of landscape that's particularly beautiful that you would want people to spend time in and to appreciate. Well, think about those areas and think about how you can make them more accessible. Could you just put in extra seating, a bench maybe, or change the surfacing so that people can access it more easily if they've got mobility problems. So there are so many things that small interventions that you can do just to change the accessibility of something that's already on your site. Seating and shelter is really important. When we get engaged with Age UK on a project in Holden Forest Park in the southwest of England, which I'll come to in a minute, one of the key factors that came up for people in that age bracket was the provision of shelter and seating, and more of it on our sites. Offer quieter areas as well as more social areas. So I mentioned earlier, there are people with such a wide range of wants and needs, different disabilities, visible, non-visible, that providing the quieter contemplation spaces for people that want that is so important. But also then there's the areas where people want to be social, they want to spend time around other people and play games with other children, and so just provide choice and options, and look for opportunities to engage with your visitor through interpretation. It's really, really important to feel, so they feel involved in your site and in your organisation and what your organisation means, and it'll help them appreciate the landscape that they're walking in, or the landscape they're spending time in, much more if they can understand more about it, and encourage them to spend more time in it. So I'll just talk a bit about good practice for trail design, and this is really about starting off with stakeholder engagement, and I can't emphasize the importance of this enough. Involving the end user in any accessibility project is really important to getting the right results. A well thought out trail network is often the starting point for making a site more accessible and encouraging visitors to be more active. So these should extend from the main facilities area, and there should be clear signage and layout. Consider maintenance, really important. A trail that is poorly maintained is not going to stay accessible for very long. Identify options for improvement. So on existing trails, is there somewhere where the surfacing needs replacing, or the gradient could be improved? So maybe it's an area that's a bit too steep, but by just diverting the path slightly, you could change it to a nice gentle 1 in 20 gradient. Could you cut back some vegetation to make the sightline clearer on the trail? Identify a hierarchy of routes in respect to accessibility. So you may have visitors who they might start on a very gentle, flat, wide, easy trail, fully accessible. But as time goes on, and after repeat visits, they might want something a little bit more challenging. So think about that, and think about the progression of people to sites, and as they get more comfortable coming to your site. Provide choice if you can. People love to be able to choose for themselves where they're going, what they want to see, what sort of trail they want to go on, and provide choice and provide the information they need to make that choice. So it might be about surfacing and gradient. Provide accessible routes to key features and highlights. So make sure that you're not just saving those amazing viewpoints for the longer trails. Make sure you've got something really, really exciting and engaging for a visitor who's maybe just doing a really short, maybe half a kilometre trail, and make sure that they can get to those, like maybe the viewpoints, maybe it's just a play feature or a sculpture or something. Widen narrow paths. That's sort of options for improvement. So where you've got an opportunity to widen a path, then do try to widen it to 2 meters as the ideal width. And pay attention to crossfall and drainage. Really important that comes into maintenance as well. So if you've got a poorly drained path, then it's unlikely to stay accessible for long. And I've just shown an example here of a trail that we've done at Holden. This is part of the project with Age UK Devon in the southwest. And you see we've got this orange line here, which is the it's a family trail, 2.5 kilometres roughly. And what we did was we resolved some user conflict on that trail, so we moved some mountain biking off the trail. There was an area where they came onto it and we moved them away. We also put in an extra loop here, a shortcut, so you could either cut your trail short in this direction, or you could just do a small loop here from the car park and back. So you've got the choices, and both of those options have access to a viewpoint shelter with seating and a play area. And then lastly, we put in a nature hide just down here. And this is only 200 metres from the car park. It's really close, but it feels very remote. That's the beauty of it. It's very quiet, dogs on leads, it's a restored heathland, and it's really, really popular, just a short trail from the car park, fully accessible. And I'll just show a few more pictures of that project here. So here's one of the viewpoints. Again, fully accessible, all level with seating inside. This is a new bit of trail that's gone in the shorter loop, and this picture here, one of the other viewpoints, some interpretation within the viewpoints. And this was our opening day with our stakeholders from Age UK Devon. And finally, I'm just going to leave you with one of, I think, probably the most important learning from this piece of work, certainly for me, has been that the aim is not to ensure that everyone has access to the same overall experience, but to an equal quality of experience. And thank you very much for listening.
Thank you, Julia. Right, we are now going to go to our final speaker of the afternoon. So it gives me pleasure to welcome John Duffy, who's the Senior Development Officer for POS for All. Over to you, John.
Okay, hi everyone. I'm going to provide you a very quick overview of the review and update of the Countryside for All guide. Okay, next slide please. Okay, so what is the Countryside for All guide? So the guide was first produced by the Fieldfare Trust in 1997 in partnership with a host of other organisations throughout the UK in response to what was then the new Disability Discrimination Act. The guide sets out a benchmarking standards and provides guidelines for assessing sites and increasing accessibility to the countryside. And at 353 pages, it's a huge document. Okay, next slide please. So, although the guide looks really old now, but at its time it was a groundbreaking document and introduced inclusive design principles and set standards for paths and trails, looking at everything from surfaces, paths, passing places, turning circles, to providing a process and a system for continuous assessment and improving the routes and sites. So just before the Fieldfare Trust dissolved in September 2018, Pastoral asked and were granted the copyright for the guide, and we committed to reviewing and updating it. So the guide is now available from our website as a downloadable PDF. Okay, next slide please. So in 2019, we started to look at the guide, looking at what had changed and what needed to be updated. So this included looking at sort of like new legislation such as the Quality Act, Crow Act, Land Reform Act, new British standards such as gates, gaps and styles, as well as new resources and reference documents on inclusive access to outdoors produced by National England, National Resources Wales, Experience Communities, Sustrans, Sensory Trust and lots of other organisations. But we also recognise that sort of like the developments and how and what people were using to access outdoors and information to it. So we decided the first step in the process was an initial review of the guide. So we secured funding to and awarded a contract with Sensory Trust. And the review focused on two key outputs. The first output was identifying stakeholders and partners to bring expertise together from across the UK. Next slide, please. Oh, yeah, that one. That's great. And then the second one was just to find out what were people using the guide for, and trying to identify what was needed to be improve it as well. Okay, next slide, please. But like everything else, COVID-19, in fact, it impacted on our kind of like our timeline or delivery plan. And then in May 2020, we launched our online survey and the guide. And then we held our first meeting of the steering group in September. Okay, next slide, please. So in terms of the survey, we had a great response to it, with 99% of them respondents supporting the production and update of the new guide. And lots of people recommended to other people. And I suppose the only one thing that's a challenge, I suppose, in a way, is 52 respondents say that the standards don't relate to some types of green space. But a big thank you to everybody that completed that survey. Okay, next slide, please. Okay, so to build on the momentum from the survey and the initial review, we secured additional funding to move into the first phase of the production of the guide itself. We're currently working with Sensory Trust towards having the first draft of the document completed by April. So that's where we're at the moment. Okay, next slide, please. So how can you help? So there's two things you can help us with. If you've got a project you think will make a great case study, then please just get in contact with us. We'd love to hear from you. And the second part is we're currently pulling together a funding package for production of the second draft of the guide. So if you're in a position to help us to fund this work, please get in touch as well. And a big thank you to all our funders to date: Nature Scot, Natural England, Forestry Land Scotland, Forestry England, Scottish Forestry, and Sports Northern Ireland. And next slide, please. And thank you for having the time to listen to me. Okay, and that's me. Thank you very much.
Thank you, Don. Very interesting update you gave us there, and I know there's many people that will be on this conference today that will have inputted and will be continuing to work on that. I remember that first document, that is how old I am, when it came out and how groundbreaking it was. So to have it updated in today's context is a really brilliant piece of work. So thank you very much for sharing it. Okay, so John was our last speaker for today. We're going to move very shortly to our interactive Q&A session, where Pammy, Duncan, Caroline, Sophie and John will all be joining us. We need to go to another link for that, and you will have been sent that in the delegate pack, and I believe it's also popping up now in your chat channel. So in a few moments we will all head off and use that new link. I think I just want to say, for anybody that's not joining us on the Q&A session, thank you so much for being with us today, and we really hope that you're going to join us again tomorrow. For me, the takeaway today is I think that we've had an amazing call to action from several speakers throughout the day. We've also shared as many different perspectives as we've been able to sort of to muster and to bring together in a one-day session, really showing and highlighting the massive amount of insight and evidence that we've got about what we really need to do, what we need to get to grips with over the coming years. And because of the COVID-19 situation and the opportunities that it presents us in the countryside sector, I think we need to take those opportunities quite quickly and as a sector. And certainly tomorrow we'll be thinking about how we do that proactively.